All right, I'm Todd Shryock, Managing Editor of Medical Economics. I'm here with Matt Dickson to talk about patient communications. Matt, thanks for joining us.
Thanks for having me. I appreciate your time today.
So, talk to me a little bit about how the COVID crisis has affected doctor-patient communications.
Well, I think there's that obvious shift, right, to digital communication from an office. And I really think it highlights the need or really emphasizes the shift from reactive to proactive communication. So today, most of that communication is done when you're there to have some sort of medical procedure done. And it's really emphasized that need to reach out to people in that more proactive way, giving them timely, relevant, and meaningful information. And in my opinion, it's really brought forward some kind of long-standing issues we've seen with the shift of the industry to value-based care type initiatives, where we need to be more active participants in our patients' long-term health and giving them the information they need in an actionable way to assist them in making those appropriate and proper decisions. So really COVID is a microcosm of just that, right? Teaching people about what does social distancing mean, how to properly wash your hands, what are things you can do to minimize your risk of transmission or getting the infection or disease. So I think it's really put a focus on those things about communication that's clearly focused and really focused around creating an outcome or a desirable action.
Okay. And what technologies out there that physicians can use to really keep those lines of communications open and keep their patients informed?
Well, I think that the industry has fallen in love a little bit with kind of purely digital communication strategies. I always caution people, don't forget about the telephone. There's still a strong preference for patients to have those communications happen over the telephone, right? These can be complex issues that they're dealing with. And you certainly don't want to deal with something that's very complex over text message. So I think let's not forget that, right? But in addition to that, you still need to have, I think text messaging is important, using social media appropriately. I mean, this has been a huge focus where more and more people are getting their information from social media, both good and bad in some instances. Chat, using your website, all of those digital communication methods. I would say that email is one that has fallen by the wayside. People typically don't interact with email like they used to. Sometimes you have challenges getting past spam filters. So really, again, focusing around, I think social is a big focus, text message a big focus, but again, not forgetting, especially with some of the most at-risk populations. So your elderly, for example, are most at risk during this COVID crisis. They still have a very strong preference to talking to somebody. So I think it's important to remember that channel as well.
Okay. For practices that may not have a lot of experience using social channels or some of these other technology-based communication forms, is it difficult to get staff trained on what they can and can't say on social media, and how hard is it to get it integrated into their normal patient communication flow?
Well, I think the good news there is that with cloud-based approaches, this is simpler than ever, right? We've seen this actually revolutionize the way companies have gone about building software, lowering those barriers to entry into that technology space. I think the same things happen here with communication. You've seen these very intuitive platforms start to crop up, all cloud-based, really built by companies that focus on simplicity and ease of use. To your point, though, around what can and can't be said, right? The really strategy there around what you want to be communicating, when you want to be communicating. I think that's the biggest lift, right? The technology lift in today's day and age is not all that challenging. I really think that the lift is around what is your philosophy, your viewpoints, and making sure that everybody's reading from the same page of music. I really think that is a difficult task, and really those platforms, I don't think do a good job of supporting um, that sharing of information in the platform itself. But there are quite a few other tools that are out there that can help do those things. Teams is a perfect example where you could create a wiki for people to easily understand what kind of information they should or shouldn't be sharing. What are your social media platforms or protocols? Um, we talked about relevant and timely information. This is another way where, again, you can help people within your practice understand what is the appropriate communication at the appropriate time, because really what we've got to start to focus on in the industry is moving past communication that is blanketed in nature and communication that is much more relevant, so that the people receiving that communication feel like it was built just for them, right? Because that's the only way to create action. And really, at the end of the day, that should be the purpose of your communication, is to create action. Sometimes that's just information sharing, but at the end of the day, that information sharing, again, should be there to produce a desirable result, right? And with COVID, it's things like how to wash your hands, right? How to social distance. And I think that where we've fallen into a little bit of trouble with this is we've given too broad of communication where people don't understand, what does that mean in actionable terms? What does it mean to social distance? I think that a lot of people may be confused about that, right? When you turn that into much more prescriptive, maintain at least 6 feet of distance, right? Now that's something people can understand and really take action on and change their behavior around. So I think that's another thing to consider when you talk about implementing that kind of strategy.
Okay. How about patients with chronic conditions? It seems like those people would fit right into what you were just talking about helping them keep on their plan. Like how can physicians communicate better with their chronic patients?
Well, I think to your point, right? It's proactive. It's helping them understand how do you maintain that treatment plan in a COVID world, right? Some physicians have instituted protocol changes. Some may want you to do a pre-screening up front to figure out and assess your level of risk before you come into the practice. Some have created different entrances for people that may be at high risk as opposed to people that may be at low or medium risk. You really just have to tell them what to expect and what to do in a very prescriptive way. And certainly, again, one of the interesting things when you talk about these chronic conditions and help managing those, as I said, I think COVID is an accelerator to some things that were already happening in the industry. I think there the focus has needed to shift on remote patient monitoring, so that these people that do have chronic conditions, you're not having to see them in the office as often to measure how well they're managing their condition. We've seen these smart devices start to come out that can do continuous blood sugar monitoring, for example, or how do you have remote connected devices that can help at a regular cadence take blood pressure and communicate that or relate that back to a physician. So this is another way where we've kind of started to practice this: stay away from the doctor's office unless it's a dire circumstance. Has really accelerated or emphasized the need to have the ability to monitor these patients remotely and understand how well they're managing those conditions.
Okay. Now, I know during the crisis, some of the HIPAA privacy laws have been relaxed a little bit just to help people engage with telehealth and get the care they need. But long term, are there any HIPAA privacy issues that the physicians really need to be thinking about before they, jump feet first into online communications?
Yeah, absolutely. So the relaxing that you're talking about has simply said, hey, if you're trying your best, I think of them as good Samaritan laws, right? If you're trying to do your level set best and you make a mistake, we're not going to beat you up over it. How long that will last, I don't know. I think the importance when you talk about HIPAA and enabling these technologies is the first step is just careful vendor evaluation and selection. You need to ensure those platforms are HIPAA compliant. But in addition to that, where I think that the providers of these services do need to do a better job is in educating those users, and I'm not talking about the patients here, I'm talking about the practice itself, educating those users on some of those best practices. So we've probably seen, a lot of us have seen Zoom in the news, for example, Zoom bombing, where people have been able to kind of figure out how to join Zoom meetings without an invitation. Those are pretty simple issues to avoid. Had you known that you should have configured your Zoom to use a password, had you known you should have configured your Zoom account to use what they call a waiting room, where you can only be led into the meeting by the meeting organizer or the meeting leader. So I think it's also important to understand what you need to do from a configuration standpoint in that platform as well, to ensure that you're abiding by those HIPAA rules, regulations, etc.
Okay. Do you think the current pandemic crisis is going to permanently change the way the doctors communicate with their patients?
Absolutely. I think we're seeing this broadly across many industries, having to refocus the way they deliver services. Really, what we've seen happen in that healthcare space, right, is that consumerization challenge. People are bringing expectations into healthcare around what that consumer experience needs to look like. So their expectations are not being shaped by what other doctors may be doing or what other physicians may be doing. They're being shifted or shaped by what Amazon is doing, that level of convenience, right? So now we're starting to see that level of convenience really change the way, even as simple as grocery shopping, right? So now we're seeing a big push into shop online, come here to pick it up, or we'll deliver it to you. It's the same thing with, here in Illinois, we have shelter in place orders. Every single restaurant now has quickly gone to either free delivery, or you come in, you pre-order, it's sitting there ready for you to pick it up, right? So I think you're going to see people want that level of convenience where they don't have to go into a doctor's office, right? So we talk about telehealth, telemedicine, and that impact. I certainly think it is here to stay. And I think it solves other challenges as well. Again, I've really viewed COVID as an accelerator to things that were already happening in the industry. We know that certain geographic areas have challenges with finding physicians to meet, especially around specialties, for example, to meet their needs. That transition to telehealth only aids and assists with that, right? So now we can figure out ways for maybe a doctor in New York to treat somebody in Montana, where they need hyper specialization but just don't have those resources available to them. If we can successfully make that transition to telehealth, I think it makes that a lot easier. I would caution, though, that even I'll say even at a societal level, we need to be careful about how we go about implementing telehealth and telemedicine. And I think my primary concern there is that these underserved populations, or even the elderly populations, are likely to be left out in this push, and it will only exacerbate existing issues with those populations getting appropriate care. When you look at swaths of population that may not have access to high-speed internet, for example, how do we successfully transition them to telehealth? When you look to say with an underserved population, for example, they may not even have a place or a space within their home to go and do a private meeting, right? To have that level of privacy required to do a telehealth visit. You have elderly population that may not be as technologically proficient in understanding how to connect to these telehealth services or providers, or may not even own the right pieces of technology to make that happen, right? They don't have a laptop with a webcam, for example. They may not have a smartphone. Now, I think some of that is starting to change. where we're seeing the proliferation of those kind of devices. But again, you're still in a world where high-speed internet, unfortunately, is not universally had, especially in rural areas. And again, sometimes you're dealing with issues where the individual just doesn't have the place in their home to appropriately or properly conduct a visit.
Okay. What will happen to doctors who don't adapt to this new reality?
Boy, I got to tell you, the way I view the world is there's two kind of challenges facing physicians today. One is consumerization, and one is the shift to value-based care. I think the doctors that don't successfully make this transition are going to be left out and left behind with both of those challenges. Value-based care is really picking winners and losers, right? So you look at what Medicare is doing with MIPS, for example. That will impact your Medicare Part B reimbursement rates plus or minus 7% this year. So if you're on the negative side of that equation and your competitors on the positive side, a 14-point swing certainly better positions you to compete, to get better waiting rooms, to have more access to these technologies that people are expecting and want. Certainly it's going to make it more difficult for those who aren't embracing proactive communication that drives action to continue to compete. And in the consumerization space as well, right? People want that convenience. If you don't offer it, they're going to go to somebody who does, right? So early movers have an advantage. I think the earlier you can successfully navigate this transition so that it does start to impact you from a financial perspective, which is going to then allow you to make even more investments. I think those people that are savvy in that regard are going to continue to lengthen their lead because they will have more resources to compete with.
Very good. Matt, thank you for taking the time today to speak with us.
Thank you. Thank you for your time as well.
Thank you, Todd. And don't forget to check out the websites of these MJH Life Sciences brands and more to get additional information across the medical field.